For this portion of the assessment, I measured ankle dorsiflexion using both a quantitative and qualitative approach to compare mobility between the gastrocnemius and soleus muscles. I started with the extended version, which is quantitative test. The participant stood in a staggered stance facing the wall with both hands slightly placed on the wall for balance. The back leg remained straight with the heel flat on the ground, while the front leg supported most of the body weight. I placed my phone on the participant's tibia and used the angle meter and angle finder app to measure dorsiflexion angle in the participants leaned forward until a stretch was felt in the calf. I made sure the heel stayed in contact with the floor and that there was no knee bending or hip rotations, which would make the measurement invalid and imply compensation. The right leg measured 55.2 degrees and the left measured 54.6, showing symmetrical range of motion and adequate flexibility in both sides. Next, I then moved on to the knee flex version, which is a qualitative SAS assessment that biases the soleus muscle. The participant again faced the wall with heel flat, but this time bent the front knee forward over the toes while keeping the pelvis neutral and heel grounded. I observed for proper control and noted whether the knee could travel past the toes without compensation. Both sides reached the green zone, indicating normal dorsiflexion mobility. There was no heel lift, pelvic rotation, or pronation collapse during the movement. Overall, these results show that the participant has normal and symmetrical dorsiflexion mobility in both gastrocnemius and soleus dominant positions, suggesting no mobility restrictions or movement limitations that could impact lower body performance.